The broadcast is now starting. All attendees are in listen-only mode.
Well, good evening, everybody, and welcome to another edition of Question Lab. I'm your host, Jeff Downing, and tonight we are going to dig into one of our favorites, pharmacology. So tonight we're going to have a number of good high-yield questions covering the topic of pharm. And to do that, we are going to be leaning on our team. Typically we have Dr. Paras Vicaria, but tonight we've got a special guest expert, and that is the one and only Sean Naji. Sean, you want to introduce yourself?
Well, thank you, Jeff. Yes, my name is Sean. I've been working with students doing test prep for a little over 10 years now. Happy to lead tonight's session. I've been with RX Coach now for over 3 years, working with students just like you and coaches like Boris and Brian, who you'll meet later, to help you on your academic goals. And I look forward to leading tonight's session.
But the one thing I want to point out is that the methodology that we use in Question Lab is it aligns with the methods that we teach the students that we work with in RX Coach. So again, we really believe in establishing a methodology that you can really lean on. So hopefully you're going to pick up some tips, especially if you're a newbie. We hope that some of the things that we lay out for you are going to be helpful as you continue your preparations. So with that, let us go and open up question number 1. Now, when I reveal the question, you're going to see actually something that's a little different than we typically do, but it's only because it's this kind of question. Our approach to answering board style questions is we like to start with by covering up the answer choices. So in this case, because the table and the information in here is going to be critical for you, we've kept this table up. But what we suggest that you do is you cover up the answer choices when you see that question, and then you read the lead-in first. And in this case, the lead-in is which set of protein and enzyme level changes is most likely after administration of this medication. So that's how we start it. We ask you to read the lead-in because that will help you, kind of home in on the information that you're going to be parsing within the vignette. So we read the lead-in, and then we go to the vignette. So let's read that now. A 55-year-old man comes to the emergency department because of chest and arm pain as well as nausea. He reports that the chest pain began 25 minutes ago and feels like someone is squeezing his chest. He also feels the pain in his left shoulder. An ECG shows ST segment elevation in leads 2, 3, and AVF. The cardiologist immediately administers a medication that is contraindicated in patients who have had an ischemic stroke within the previous 3 months. So again, let's read that lead-in. Which set of protein and enzyme level changes is most likely after administration of this medication? What I'd like you to do to start with, go to the question box. Let us know how many steps you think it will take to answer this question as I pass it off to Sean. Sean?
Well, thank you very much, Jeff. So we're going to go ahead and show you what we think are the most important clues in the vignette and lead-in. Great. So as you can see here, we've gone ahead and kind of highlighted what we believe are the most important clues in the vignette and lead-in. So starting at the top, you always want to make note of how old the person is. We know they're 55 years old. Why are they coming to the emergency department? Chest and arm pain as well as nausea, right? When did the pain begin? It began 25 minutes ago, and it feels like someone's squeezing his chest, right? And he feels it also in his left shoulder. And so the ECG, they tell us, shows a ST segment elevation. They were nice enough to give us that clue. And they even tell us which leads the elevation was shown in, right? And then it says that the cardiologist administered medication that is contraindicated in patients who had an ischemic stroke in the past 3 months. So those are important clues to help us get to the right answer. And it's asking us, you know, what enzyme changes are most likely going to be seen here after administration of this medication. So I highlighted those clues for you. You know, they've given us some great clues in this vignette. So let's go ahead and think about, you know, how many steps it's going to take. Well, this is likely a 3-step question, right? So we got to, you know, diagnose what's going on here, which they gave us some good clues to do that. We have to figure out, you know, which drug that is contraindicated and why in this patient, right? Because they tell us that. And last, we got to figure out what the mechanism is so we can see what's going to happen with all these enzymes. So let's go ahead and take a look at these answer choices, which you already have them. They're listed. So answer choices are, and we'll always start at the bottom and work our way up. In this case, you know, the answer choices are the same as the letters. So it's a little easy, but we always start at the bottom and work our way up. And the reason we do that is because we don't want you to see an answer choice that's going to help guide or dictate your thought process. Oftentimes what will happen is if you start on the top and you work your way down, you might skip it and prematurely select an answer without looking at all the other answer choices. So we'd like to start at E and work our way up. So answer choice E is obviously just E, D is D, C is C, B is B, and A is A. So take a look at that chart, and I'll give, we're going to open up that poll and give all of you a few moments here to select your responses.
Okay, excellent. Thank you, Sean. So again, I want you to take a couple of moments, kind of figure out what sequence of arrows matches the choice that you've got your heart set on, and then what we're going to do is we're going to open up the poll. Okay, everyone, have you locked in on your answer choice? Okay, then what we do is we will launch the poll. So let us know which set of protein and enzyme level changes is most likely after administration of this patient's medication. We'll also remind you that when it comes to USMLE Step 1, you don't want to leave any answer choices unanswered. Well, you don't want any questions left unanswered. You're not going to get penalized for that. So definitely want to make sure that you mark every question, and we definitely want you to ensure that you answer every question tonight. This is a good learning exercise. Okay, with that, I'm going to go ahead and close the poll. Looks like almost 3/4 of you have answered. So let's close this poll. And let's get ready. So you can see the array here and the answer choices. I'm going to share the results. And it looked like most of you went with answer choice B. But there was a split in the race for second place between C, D, and A. So interesting results. So I'm going to hide these results, and we're going to reveal the answer. And the answer is answer choice B. So nice work, everybody. That consensus favorite. And if you didn't get it right, which is okay, this is all about learning. Sean is going to help point you in the right direction. Sean?
Well, thank you very much, Jeff. So, you know, like we said, this is likely a 3-step question. So the first thing is we got to figure out what's going on with this patient, right? So they told us he's got ST segment elevation. We're looking at most likely a myocardial infarction, right? And they tell us the leads, and those are the inferior lead. So we know where it's at. We know it's probably going to be an inferior wall ST segment elevation. So what are we trying to do here? What we want to do is give a medication that's going to help break up that clot and help reperfuse that heart with oxygen, right? So how do we break up a clot? We break up a clot by administering a TPA mimetic, or a tissue plasminogen activator mimetic. And those are the drugs that end into place, right? Like alteplase, retiplase, or tenecteplase. So absolute contraindications to drugs like this, especially alteplase or other ones, is we can't give them to patients who have a history of certain things. And one of those is intracranial hemorrhage. And we know that this person had a stroke. So we are likely leaning now towards a drug like alteplase or alteplase itself, right? We also can't give this drug to people who've had structural cerebral vascular lesions, ischemic strokes within the past 3 months, aortic dissections, and they told us he's had an ischemic stroke. So we know we can't give this medication to them. It is contraindicated in this patient, right? That is contraindicated in patients who have had an ischemic stroke within the past 3 months. So the drug that we're talking about is going to be this TPA activator mimetic. And so these drugs are thrombolytic drugs. And what they do is they are used in acute settings where we want immediate fibrinolysis, so that we can reperfuse that heart and the myocardium. So we want to give this drug within 30 minutes of the patient presenting to the ED if they have an ST segment elevation. And we do that because, you know, we want to reperfuse that heart as fast as possible. Well, how do these TPA mimetics work? Well, what they do is they act to convert plasminogen to its active form, which is plasmin. So now, as a test taker, so when you look at a chart like this, and you know the first thing, you know that plasmin, okay, is going to have to go up, right? Because you're converting plasminogen to plasmin, so plasmin levels have to rise. So just by looking at that chart now, you can rule out a couple of answer choices, and that's the easiest way to do it. Go one enzyme at a time, because sometimes if you get 2 enzymes or 3 enzymes, you can save yourself time and eliminate the other answer choices. So now we know that because of that, we can eliminate answer choice D and E. Well, what else does plasmin do? Well, plasmin acts on fibrin and fibrinogen to degrade those enzymes. So if plasmin is degrading those enzymes, levels of fibrin and fibrinogen then must go down, right? So they must go down. So now you're down. Now you can eliminate answer choice A. So now you're left with answer choice B and C, because those are the only 2 choices where plasmin goes up and fibrin and fibrinogen both go down. So now we look at, and so we know what's happening in plasminogen also, right? Because plasminogen is being converted to plasmin, therefore plasmin has to go down, right? So now the only thing that's left to decide and to look at really is what's going to happen to D-dimer. Well, D-dimer is a byproduct of the fibrin degradation process, right? So that means if it's a byproduct of that process, that level then must go up. And so if you look at the answer choices, right, plasminogen must go down, plasmin must go up. When plasmin goes up, generally speaking, fibrin and fibrinogen are going to go down. And when that goes down, the byproduct is D-dimer, which then has to go up. So the answer choice that we're left with is answer choice B. Now, normally we'll explain why each other answer choice is wrong. So let me do that briefly now, even though we talked about it in the process of elimination, right? So E is incorrect because plasminogen activation would lead, like I said, to increased levels of plasmin and decreased levels of fibrin and fibrinogen. So you can eliminate that answer choice. Answer choice D, same thing. Plasmin levels are going down there. We can't have that happen. Fibrin and fibrinogen are also going up, which is the opposite direction, okay? So that leaves us now with answer choice C. Well, C is incorrect because if you look at C, the D-dimer is decreased, which actually needs to be increased instead. So that answer can be eliminated as well. Why is A wrong? Well, A is wrong because plasminogen, okay, is going up. That can't happen because plasminogen is being converted to plasmin. And if plasmin is going up, then fibrin and fibrinogen must go down. That's not happening there. So you got plasminogen is going up and fibrin are both going up as well. So that's why we can eliminate answer choice E, leaving us with answer choice B. Jeff?
Excellent. Thank you, Sean. Thank you for the great breakdown of those answers. Let's go ahead and go to question number 2. So again, what we're going to do is we're going to reveal the question, and in this case, you definitely don't see these answer choices. So with that, let us again start with the lead-in. Which of the following medications is the most likely cause of his increased serum creatinine? Okay, look at that and kind of think to yourself, what kind of information am I going to be looking for when we read the vignette? A 37-year-old man comes to the emergency department with difficulty breathing and a productive cough for the past 4 days. He is diagnosed with pneumocystis jirovecii pneumonia and is found to be HIV positive with a reduced CD4 cell count. He is placed on several medications to manage his condition. 3 weeks later, his serum creatinine concentration has increased from 1.1 to 2.8. So again, the question, which of the following medications is the most likely cause of his increased serum creatinine? Think about that. Let us know how many steps you think it will take to answer this one as I pass it over to Sean.
Well, thank you, Jeff. So let's go ahead and take a look at what we think are some of the important clues in this vignette and lead in. So as you can see here, always the demographics. He's 37 years old, got difficulty breathing, productive cough for 4 days, and they tell us he's diagnosed with pneumocystis jirovecii pneumonia. He's HIV positive, got a reduced CD4 count. He's on several medications. And then all of a sudden we hear that 3 weeks later, his serum creatinine concentration has increased from 1.1 to 2.8. And they're asking us, which is the medication that's the most likely cause of his increased serum creatinine, right? So, this is likely, it's pretty straightforward, likely one-step question. We just got to figure out, what drug is causing this. So let's take a look at those answer choices and see if we can't get to that answer. So once again, we're going to start with E and work our way up. Answer choice E, zidovudine. D, tenofovir. C, raltegravir. B, enfuvirtide. And A, abacavir. So we're going to go ahead and open up the poll and give all of you a few moments here to respond and let us know what you think the correct answer is. And then, as always, we'll review the correct and incorrect choices.
Fantastic. So the poll is open. Go ahead and let us know what you think is the most likely cause of this patient's increased serum creatinine. Okay, looks like about half of you have voted. I think some of you are trying to kind of think through the drug index in your mind, wondering which one fits the bill here. So go ahead and make your selection. And what we're going to do, it looks like almost 3/4 of you have voted. So we're going to go ahead and close the poll. And we'll show these results. So again, in this one, we've got, it's kind of a two-horse race here between D and E, although all of the choices received double digits in terms of voting percentage. So let us go ahead, hide those results, and see what the correct answer is. And the correct answer is D, tenofovir. So once again, we just eked out a win with this one. So that was the leading vote getter, but a little challenging question here. So what we're going to do is we're going to turn it over to Sean to help break it down for you. Sean?
Well, thank you, Jeff. So they gave us some really good clues here, right? They told us about HIV. They told us pneumocystis jirovecii, and then they told us that serum creatinine concentration has gone up. So we have to figure out what drug can we use to treat this condition that has a side effect of increasing serum creatinine. And the answer there is tenofovir. And tenofovir ends in vir, so it's a reverse transcriptase inhibitor, right? And we use that in the treatment of HIV, and that's likely was part of this person's medication regimen. He's on several medications, and tenofovir is likely one of them. Now, tenofovir, along with one other drug that's not an answer choice, I'll go ahead and say it. It's atazanavir. So tenofovir and atazanavir, they're both associated with nephrotoxicity. They're both associated with nephrotoxicity. Okay. And one way I remember this drug, and it may or may not help you, is kidney damage can be caused by alcohol. So if you have 10 beers, if you have tenofovir, if you have 10 beers, you might kind of think about the 10 beers and injuring your kidney. That's how I remember that tenofovir is associated with nephrotoxicity. I'm not saying that if you did that, you would actually injure it. Just a way for me to remember it. If it helps you, use it. If not, don't worry about it, right? So tenofovir and atazanavir are associated with nephrotoxicity, specifically with proximal tubular injury, or Fanconi syndrome. as well as acute kidney injury, which will then cause this rise in serum creatinine. Now, some other side effects associated with tenofovir are reduced bone density, nausea, and headache. So if you want to, go a little further, some other side effects of that medication are bone density loss, reduced bone density, nausea, and headache. Now let's look at the other answer choice. So we have zidovudine. A lot of you guys selected. That's okay. And you might be thinking that because it does cause some problems that may be related to the kidney, such as lactic acidosis, right? But that's not what they're talking about here, right? It can also zidovudine can also cause peripheral neuropathy, but it's really known for the side effect of bone marrow suppression. So whenever you see zidovudine, think about bone marrow suppression. That's associated with all those, penias, anemia, leukopenia, neutropenia, something like that, because the bone marrow is being suppressed. And that's not what they're asking us about here. Tenofovir, we know, is the correct answer. Then we have raltegravir, and a good amount of you selected that. That would have, if I had to guess, I thought that might be the second most picked answer, simply because it's similar to tenofovir in verbiage, as in it causes an increase in creatinine phosphokinase and not serum creatinine. So a lot of people get confused and pick that one instead. And that may have happened to those of you who picked it, but keep in mind that raltegravir is going to cause an increase in creatinine phosphokinase and rhabdomyolysis. Okay, so those are the side effects associated with that drug. Enfuvirtide, that's known to cause hypersensitivity reactions and the increased risk of bacterial pneumonia. Okay, and so some of you, saw the pneumonia in the question, may have, got word association involved in and picked that one. That is, however, the incorrect answer. Bactravir is also similar to zidovudine, as it also may cause bone marrow suppression, but it's also known to cause lactic acidosis, just like zidovudine. What sets bactravir apart is that it's also associated with two other side effects that are different from zidovudine, such as headache and fatigue. Okay, so the correct answer here is tenofovir. Reason being is because tenofovir, along with the other drug I mentioned, atazanavir, is associated with nephrotoxicity, specifically proximal tubular injury and acute kidney injury, which can cause your serum creatinine to rise. Jeff.
That is fantastic. Thank you, Sean. Want to gotten a couple of nice shout outs from the crowd. Thanking Sean for his great explanation. So that's great. We're halfway through. I do want to note that we're going to have a raffle at the end of tonight's event. Someone's going to walk away with a subscription to RX 360 Plus. But before we get to our next question, just want to remind you about RX Coach. RX Coach is the tutoring service developed by the team behind First Aid for the USMLE Step 1 and the whole First Aid series, as well as USMLE-Rx. When students ask us, well, what sets us apart? Our DNA kind of sets us apart. The fact that we've been in this game for 30 years and have been really working to help med students prepare for the boards and prepare for the exams that are so crucial in med school. Our focus though is on you, right? We want to make sure that you're ready. So when we start an engagement with a student, we always start with a 160 question assessment, and we use the results of that assessment to figure out, where your strengths and your challenges might be, and so that we can develop, a personalized study plan with you. This is not an online course. It's not a mass lecture type of approach. It's a one-on-one approach where you're working with tutors like Brian, who have gone through the RX certification process. And in terms of having, really solid, high yield resources, every student that signs up does get complimentary access to RX 360 Plus, which includes Step 1 QMAX and the bricks. So, for us, we really want to make sure that you get where you want to go, and our coaches are really in service to you. So, if you're interested, I've got the link there in the chat, rx-coach.com. You can set up a free consult to learn more about the program. And again, if you like what you hear, we can put that plan together for you. Okay, so let's go ahead and we're going to move on to the next question of the evening. Question number 3. So everyone kind of stretch out a little bit and get ready as we start with the lead-in. Which of the following adverse effects is this patient most likely to experience? I'm going to quickly break down that question, figure out what it is that you're looking for as we read the lead-in or the vignette. A 27-year-old woman presents to her physician with burning on urination. Her urine sample tests positive for leukocyte esterase and nitrite. She is treated with a first-line drug that inhibits bacterial topoisomerases. Which of the following adverse effects is this patient most likely to experience? Think again how many steps you think it will take to answer that one. Go ahead and put it into the question box as I turn it over to Sean.
Well, thank you, Jeff. Once again, we're going to go ahead and show you what we think are the important clues in the vignette and lead in here. Let's take a look at those. Once again, 27-year-old woman, right? She's presenting with burning on urination, and she's got positive tests for leukocyte esterase and nitrite, and they treat her with a first-line drug that inhibits bacterial topoisomerase. They gave you a great clue there. And they're asking us which of the following adverse effects is this patient most likely to experience. So this is likely a 3-step question. We've got to figure out what's going on with this patient, what drug has this mechanism, and then what the side effect of that medication could be. So let's take a look at those answer choices and see if we can figure this out together. So side effects listed here are E, tendinitis, D, ototoxicity, C, myalgia, D, diarrhea, and A, arrhythmia. So we're going to go ahead and open up that poll for you and give you a few moments here to select the answer that you think is correct.
Okay, fantastic. So the poll has been launched for question number 3. Go ahead and figure out which of these following effects most likely going to occur with this patient. Let's see, the votes are starting to trickle in here. About a third of you have voted so far. Okay, and again, make sure that you don't leave any question unanswered on test day. We know as you get closer to your board exams that a lot of it kind of moves away from just being able to answer the questions, but you need to be able to answer the questions with pace, right? You don't have all day to answer them. You've got a lot, basically 90 seconds. So time does become a factor. Well, it looks like over 80% of you have voted. So we're going to go ahead and close this poll. And let's share the results. And again, well, it's kind of a mix here. Tendinitis is the leading vote getter with diarrhea right behind it. Toxicity in third place. So interesting. Let's go ahead and hide those results. And let's reveal the answer. And the answer to question number 3 is answer choice B, diarrhea. So the runner-up in the poll turns out to be the right answer. So if you didn't get that one right, that's okay. Sean is going to lead you to the rationale why.
Well, thank you, Jeff. So the key to answering this question was not finding out which side effect this medication can cause. It was thinking about what's the most likely side effect that this patient is going to experience, right? So let's see what's going on here. So you got a positive leukocyte esterase and nitrite test. So this means you've got leukocyte activity, which means you've got the presence of gram-negative bacteria, right? So we're thinking here, this patient, based on the symptoms, burning or urination, gram-negative, bacteria, probably has cystitis. And what is known to most often or most likely cause cystitis? That is a bacteria by the name of E. coli, which is a gram-negative rod, right? So now we have to find a drug here that we can use to treat this gram-negative rod, and they tell us that the drug is a first-line drug that inhibits bacterial topoisomerase. And so fluoroquinolones inhibit DNA gyrase, which is a bacterial topoisomerase, right? And so ciprofloxacin is the drug they're talking about, okay? So ciprofloxacin is a fluoroquinolone antibiotic that inhibits DNA gyrase, which is a bacterial topoisomerase, and we use that to treat conditions like this. So now we got to figure out what the side effects are. Well, the way I remember fluoroquinolones is fluoroquinolone kind of sounds like flow at the beginning, right? And so the way I remember it, it's a little silly, but it works for me. Maybe it'll work for you. Fluoroquinolones make your feces flow. You get diarrhea, okay? You get diarrhea with fluoroquinolone. That's a very, very common side effect, right? Now, why are the other answer choices wrong? And they're not necessarily incorrect completely. If they took the words most likely out, then it'd be a toss-up, right? But they didn't take it out. They left it in there. And so most likely side effect is diarrhea. Let's go to E, tendinitis. Look, you can have tendinitis and tendon rupture as well as other connective tissue injuries, but that happens rarely, okay? So that's not the answer choice that we're looking for here. Ciprofloxacin is known to cause 3 side effects, okay? Other than that, and those are myalgias, arrhythmias, and tendinitis, and they're all on the list, right? But that happens rarely in less than 1% of people, Ototoxicity. Ototoxicity is associated with different categories of drugs. They're mainly associated with aminoglycosides and vancomycin. So ototoxicity, is associated with vancomycin and aminoglycosides, and that's not what we're prescribing here. Like I said, myalgias can be caused by ciprofloxacin, as can answer choice A, arrhythmia, but that's going to happen very rarely in less than 1% of patients. So what we're looking for here is the most likely adverse side effect in this 27-year-old, and that with ciprofloxacin is going to be diarrhea. So challenging question, but great job, everyone.
Yes, indeed. Yeah, nice work, everybody. Obviously, there's a lot of things to kind of work through, even though you don't necessarily have a ton of information, a ton of data here to start with. So hopefully you're kind of picking up some of the key steps that you're going to need to take. So nice work. Let's go ahead and we're going to try to close really strong. Okay, we got question number 4. And this is going to be the final question of the night. We are going to have a raffle at the end of this. So everybody stay tuned. So let's buckle up and see what we can do here with this question. So again, one more time, answer choices are covered up and we read the lead in. Which of the following describes the mechanism of action of the most likely prescribed eye drops? Look at that. Think about the kind of information you're going to try to glean from the vignette as we read that. A 64-year-old woman is diagnosed with Sjogren's syndrome after complaining of dry mouth and eyes. On physical examination, her eyes are red and irritated. She has started on eye drops to improve her dry eyes. These drops also cause her pupils to contract and can be used to treat glaucoma. So once again, the question, which of the following describes the mechanism of action of the most likely prescribed eye drops? Think about what you've been presented here and tell us how many steps you think it will take to solve it as I pass it over to Sean.
Well, thank you very much, Jeff. Let's take a look and see what some of these important clues are in the vignette and lead in. So we've got a 64-year-old woman diagnosed with Sjogren's syndrome. She complains of dry mouth and eyes. Her eyes are red and irritated. They give her eye drops. And these drops cause her pupils to contract, and it can be used to treat glaucoma. So what's the mechanism of action of this drug? All right, some great clues here. How many steps are we looking at? Likely 2 steps, right? We've got to figure out the drug, We got to figure out the mechanism of action. So let's see what our answer choices are and see if we can't figure this one out. Answer choice E, increase in intracellular adenosine monophosphate, or CAMP. D, increase in intracellular calcium. C, deactivation of protein kinase C. B, activation of protein kinase A. And A, activation of adenylyl cyclase. So let's take a look, a moment here, give all of you a moment here to take a look at the poll and select the answer you believe is correct, and then we'll go over the explanations.
Okay, the poll has been launched. Think about what answer is right here for which of the following describes the mechanism of action of the most likely prescribed eye drops. It's one of those questions, kind of interesting structure of the question, interesting presentation of the details. What do you think is that mechanism of action? Let's see, almost half of you have voted, so go ahead and take your shot. A lot here to process. Looking at the votes pouring in so far, we've got a favorite, but it's not an overwhelming favorite. Okay, so we've got, let's see, almost 3/4 of you have voted. So we're going to go ahead and close this poll. And let's share the results. So let's see, the crowd is in favor of answer choice A, activation of adenylyl cyclase. But again, not much separation in between the various runner-up candidates. So obviously we had some questions about this one. So let's go ahead. We'll hide the results and go ahead and share the answer. And the answer is answer choice D, increase in intracellular calcium. So this was the runner-up with 21% of the vote, but clearly a challenging question. So Sean, help us break this one down.
Well, thank you very much, Jeff. I have a feeling that if they had asked us, which receptor this drug works on, a lot more people would have gotten it right. But it required us to go one additional step, and that's probably where a lot of people got tripped up here. But don't worry, we're going to go through it now. So what are we trying to accomplish here? We're trying to accomplish solving her problem of dry eyes. And they tell us that the medication, the eye drop that we're giving, can also be used to treat glaucoma, and it causes pupils to contract. So now we know what this drug can also be used for. So when pupils contract, we call that miosis, right? So what causes miosis and can be used to treat glaucoma and help dry eye symptoms? Well, if you remember back from when you were studying pharmacology, you know that you had that M3 receptor, those anticholinergics that always made you hot and dry. Well, we were trying to accomplish the opposite of dry, which is wet. So instead of anticholinergics, which make you dry, we want to make you wet, right? So that is a cholinergic, which is the opposite of an anticholinergic. So cholinergics work on the parasympathetic system. So you can call them parasympathetic agents, you can call them cholinergic agents, or you can call them muscarinic agents because they work on muscarinic receptors. And specifically in this case, the drug they're talking about is pilocarpine. And pilocarpine works on the muscarinic type 3 receptor. And the muscarinic type 3 receptor, if you go to the next slide, please, Jeff, we have a nice little chart here from first aid, will increase your secretions. It'll increase your exocrine gland secretions. It'll increase gut peristalsis. It'll increase bladder contraction leading to urination. It'll increase bronchoconstriction, making it harder for you to breathe. It'll cause miosis, okay? It'll cause increased insulin release as well. So here we go. It increases your ciliary muscle contraction, and that causes accommodation. So that's the category of drug they're referring to, and the drug they're referring to specifically is pilocarpine. Now, if you look at M1, M2, M3, And in the next column, you see what subtype of G protein coupled receptors they are, and it's QIQ going up, down. So M1 is Q, M2 is I, M3 is Q, okay? So because this is a muscarinic agonist or a cholinomimetic or a parasympathetic agent working on that muscarinic type 3 receptor, which makes you wet, right, which causes leakiness, and is also used, it can be used, this drug specifically for glaucoma, which they give us that clue. It's going to stimulate, it's going to work through that Q subtype G protein coupled receptor. And that subtype causes sarcoplasmic reticulum to release intracellular calcium via phospholipase C activation. So we can get really into that mechanism, but what you really should know is anytime you see GQ, okay, you're going to be causing sarcoplasmic reticulum release of intracellular calcium. So if you can go back to the next slide, please, Jeff. So whenever you see, there's a tip here, whenever you see them say, you know, you're trying to fix dryness, always think about cholinergics and anticholinergics. Remember that anticholinergics cause you to be dry, so cholinergics are the opposite. Cholinergics work on muscarinic receptors. The drug here is pilocarpine. And when you saw the muscarinic receptors, type 1, type 2, type 3, just remember QIQ. Remember Q, anytime you see a G protein Q-type receptor, increase in intracellular calcium. So that's why answer choice D is correct. Why are the other ones incorrect? Well, increase in intracellular CAMP, that occurs via the GS receptor pathway, okay, via adenylyl cyclase. So that's not what we're looking for here. We're looking for GQ. So we're going to go up now to answer choice C because we know D is the correct one. Deactivation of protein kinase C, that doesn't occur. Protein kinase C is one of the second messengers that's activated and involved in the G2 pathway, but that's used mainly in the GI tract, So that's not what we're looking for here. We're looking for increased intracellular calcium for pilocarpine. Then we've got activation of protein kinase A, and that happens via CAMP, which is a product of GS, the GS subtype, and stimulation of adenylyl cyclase. So that's not what we're looking for here. I know a lot of you selected that. And then we have activation of adenylyl cyclase, and that occurs via the GS pathway, and it's blocked by the GI pathway. So what you're looking at here is really a kind of a nuanced question. It's a detail-oriented question. It's a detail that you should always know and keep in mind. And the trick to getting it right and keeping that detail straight is going and remembering that chart that you saw and remembering the protein subtypes. And this one was a Q subtype. And when you see that, especially in the case of this drug, we're talking about muscle-related effects that you want, you know, you're going to be thinking about the sarcoplasmic reticulum causing those calcium levels to increase intracellularly. So that's why the correct answer here is D. Always a good idea to have a good hold on these cholinergics and anticholinergics. They're very high-yield drugs. They come up a lot, and pilocarpine is certainly one of them. So take a look at that chart if you haven't. Make sure you study it because you will encounter this in practice and on exams in the future. I'll hand it back to Jeff.
Excellent. Thank you, Sean. Again, just some magnificent explanations tonight, great breakdowns, and a lot of nice little tips and tricks to help you remember some of these, challenging and sometimes difficult to memorize elements. So again, nice work, everybody. This is, I think we had a number of really good, helpful questions. At least it's going to help you as you prepare for the types of pharm questions you're going to see on test day. What we've done here is we've kind of laid out all of the QIDs. So you can, fire up your USMLE-Rx account and plug in those QID numbers into Rx Search. So if you want to dig a little bit deeper, nice thing in, obviously within USMLE-Rx is that not only can you dig in and read the full explanations for the questions, but you can also see any of the related first aid pages, as well as the related RX bricks and express videos, and even the flash facts. So go ahead, you can screenshot those numbers or write them down and continue to study on your own after tonight's session.